In this section of the video, I will be talking to you about the different types of donor surgery, the recovery period, and the associated risks of the operation. Essentially, there are two ways of removing a kidney from a living person. There's the open surgery and there's keyhole surgery, which is otherwise known as laparoscopic surgery. We do prefer the laparoscopic approach as the recovery period for the donor is much quicker. However, you do have to be aware of the open surgery, as we might find during the keyhole procedure that we cannot proceed safely, or there might be bleeding where we have to act quickly. We will then convert to the open procedure. For the open approach, we make a cut on the side of the abdomen just underneath your rib cage. For keyhole surgery, we will perform a small cut near your belly button and two further small cuts just on the side of the abdomen below the rib cage. All the operation will be performed through these incisions, and when the kidney is ready to be removed, we make a further cut in the groin. The advantage of the incision in the groin is that it is less painful after the operation than any incision near your rib cage. At the end of the operation, the incisions will be closed with stitches underneath your skin. These dissolve by themselves. There will also be a small plastic tube called a drain, which will come out of one of the incisions we made earlier. In addition, you will also have a urinary catheter. Both the drain and the catheter will be removed the following morning. Prior to the surgery, the anaesthetist will have a talk to you about pain control. Usually this will be in the form of a morphine button, otherwise known as a PCAS. This is a very safe and effective way of giving you painkillers. In addition, we will also be prescribing you tablet painkillers. The usual sequence of events is that you will be admitted the night before surgery. This will allow you to be ready for theatres for 8 o'clock the following morning. The operation itself takes about 2 to 3 hours. After this, you will be moved to the recovery area, prior to being moved back down to the ward. There you might find yourself to be slightly sleepy. This is normal and nothing to be worried about. By the evening, you may feel a little bit hungry and you may want to have something to eat or drink. This is actually something we encourage, as this allows you to take tablet painkillers. The following morning, we will remove the drain, catheter and morphine button. This will allow you to start moving about, and hopefully by the afternoon you should be able to be discharged home. When you're at home, the first couple of weeks, you might feel slightly tired. Again, this is normal, but you should see a gradual improvement every day. If you enjoy exercising, such as cycling, running or swimming, we would advise you not to do this for about 4 weeks. And when you start doing exercise, you should do this slowly. You should certainly not do any heavy lifting for at least 6 weeks following the surgery. On average, we would expect you to be back to completely normal by 8 to 10 weeks following keyhole surgery and 10 to 12 weeks following the open surgery. Depending on the type of work you do, you should be able to return to work after about 4 to 6 weeks. We do not have any strict guidelines on driving. However, we do advise you not to drive your car for about 2 weeks following the surgery. You have to be able to make a safe emergency stop, and you should check on your insurance policy whether you have to contact your insurer. All the risks associated with live kidney donation are very low. However, it is very important for you to know about these, as you are a healthy person who does not need to undergo the operation. Firstly, and most importantly, there's a risk to your life. It has been estimated internationally that 1 in 3,500 donors may not survive the procedure. With any operation, there's risk of bleeding. This may be simply in the form of a small bruise around one of the cuts, or it may be large enough to require for you to have a transfusion. This would occur in about 3 in 100 people. Very rarely would we have to reoperate to stop any ongoing bleeding. The risk of acquiring a wound infection is in the region of 1 to 2 per 100 cases. Usually your GP would prescribe some antibiotics, as you would already have been discharged by the time it is recognized. The longer you stay in a hospital bed, the higher the risk of acquiring a chest infection. Again, this is one of the reasons why we prefer laparoscopic surgery, as your discharge home is much quicker. Clots in the veins in the legs and clots in the lung, otherwise known as deep venous thrombosis and pulmonary embolism, are also associated with this type of surgery. The risk can be reduced to less than 1 in 200 cases by giving you special stockings to wear. You should wear these stockings until you're back to normal. We will be giving you 2 pairs to take home with you. In addition, you will also receive a daily injection of a drug to thin your blood down slightly. You will be given a total of 7 of these injections. The first 2 will be in hospital, and for the remaining 5 we will teach you to do it yourself. But don't worry if you can't do it yourself, because we can send a district nurse out to your home to do this for you. The scar on the groin may be slightly weak and you may notice a small bulge called a hernia. This can usually be repaired with an operation at the later stage. With laparoscopic surgery, other surrounding structures such as the small bowel, spleen or diaphragm are also at risk of being damaged. Obviously any damage will be repaired straight away. However, if the diaphragm were to be punctured, this is like having a punctured lung and will require a special drain called a chest drain. This stays inside you for about 24 to 48 hours and will delay your discharge home by a day or two. However, it should not affect your long-term recovery. When the left kidney is removed in a man, we have to disconnect a small vein that drains the left testicle. This may lead to some swelling and pain in the left testicle. However, it should settle down by itself and only require simple painkillers. This will not affect your fertility or your sex life.